Welcome to Trust, Then Know, the Jackie Boyd Podcast, a podcast providing education, information, and mostly inspiration that will help you become the best version of yourself. Join host Jackie Boyd for engaging and intriguing conversations. Now, Trust, Then Know, the Jackie Boyd Podcast.
Hello, and welcome to the Trust and Know, the Jackie Boyd Podcast. This is episode 17. Can you believe that? Episode 17. We are coming up on 1 year. Tonight's show is so exciting. Thank you for joining us. Thank you for staying with us. Thank you for being a part of the Trust and Know Jackie Boyd Podcast family. Listen, we come on every second and fourth Tuesday of every month on all your major podcast platforms. So you can catch us just by putting in Trust, T-R-U-S-T, then Know, K-N-O-W. So listen, tonight I have a very special guest, Dr. Christina Jade Monford-McNish. Hi, Christina.
Hello
Doctor, do I call you Dr. Christina, Dr. Monford-McNish? What do you want to go by?
You know, more recently, there's been a poll, and I've been going by Dr. Chrissie. So
Dr. Chrissie?
Yeah, that's
okay.
like the newer thing. So
okay.
I'm riding with the Dr. Chrissie.
Dr. Chrissie. So we're going to call you Dr. Chrissie.
You got it.
But her beautiful full name, again, is Dr. Christina Jade Monford-McNish. And she is a local celebrity here, you might as well say.
Celebrity. Oh.
She is a native of Jacksonville. She is a die-hard rattler. She finished her degree with her dental education at UF. All right.
Okay.
And now she is practicing. She's been practicing for over 10 years. She is part owner of Tropea Dental Care here in the Jacksonville Town Center.
Yes.
You are doing the thing.
Hey.
Dr. Chrissie.
Walking in purpose. Absolutely.
Walking in purpose. I love that.
Absolutely.
So listen, we want to talk to you because not only are you providing such a much needed service, but she's also a lover of her community. She's a member of the alumni chapter of Delta Sigma Theta Sorority Incorporated here in Jacksonville. Absolutely. She is also a lifetime alum member of FAMU.
Absolutely.
And she participates in so many community events, so many ways to help people gain a beautiful smile,
Absolutely.
Gain confidence, creating a really wonderful dental experience and building relationships along the way. What else can you ask for? She's a mother of three. She's a wife. She's a friend. And so we're just going to dive in with you today, Miss Chrissie, Dr. Chrissie.
Let's go. Let's go.
So I'm telling you, so many people have fears about the dentist.
Absolutely.
So we're just going to dive in. I know this is on everybody's mind. Why are people afraid of the dentist?
Believe it or not, most people will associate those fears with some sort of previous trauma.
Okay.
The unknown, when you come to a dental office, most of those offices you're going to hear certain sounds. There's some offices we have a peculiar smell. Okay. But most of the time we have to pick up that Explorer and it looks like a hook. We carry a syringe or needle, so most people are fearful of getting injections or shots. And then there's that the drill.
Yes.
So those are all things that most people are fearful of, and they've had some sort of traumatizing experience, whether it had been as a child or even in their adult life. Absolutely.
Wow. You talked about the sounds. Mm-hmm. And I know, I wouldn't say I'm afraid of the dentist, but I do get anxiety when I come. Mm-hmm. You know what I mean? Mm-hmm. It's not a place where it's like, oh, I'm going to the dentist. But the sounds they can be unnerving. I'm sure. They can be very unnerving. Yeah. And then there's something about the mouth that people are so connected to.
Absolutely.
So talk about that a bit. Like, what is it about the mouth that people are connected to? Obviously, it's a part of your body, but just dive into that for me.
Well, the mouth is it's a very private place. Mm-hmm. It's also a very delicate place, and it's very intricate, especially if you are experiencing that of a toothache, So I've had people say, I'd much rather go through childbirth than to have a toothache. And after one experiencing childbirth and have experienced, say, a toothache in my life, I can definitely say that it is very close to that of those contractions. So most people will then relate their worst pain imaginable to that of, say, whatever they might have experienced. And so oftentimes if I'm trying to gather a patient's scale of pain, I would always say, well, if you, on the pain scale of, 1 to 10, 10 being the worst pain imaginable to them, right? I ask them, what would their pain level or pain scale be? So oftentimes if patient says, oh, 1 or 2, that just tells me like, oh, okay, so then this may not be too bad.
Okay.
But if a patient says, oh, I'm experiencing 100, it's like, oh, this must be really painful.
Yeah.
So sometimes I've actually had to get patients numb. Just so that they can have a conversation because they're in that much pain.
Wow. Wow. So the pain and then the anxiety and the fear combined, I'm sure that's just a bad experience.
Wow. Yeah. Well, not always. So that can also trigger, hypertension. Like if a patient already has underlying heart issues or heart disease. So that can, in fact, trigger a spike or an elevated blood pressure or in which if, we cannot control that blood pressure, we may not be able to proceed with the procedures. So, we do, in fact, we are regulated and encouraged by the American Dental Association to take, blood pressures just to make sure that if we're going to be administering any local anesthetic that can cause an increase in that heart rate, our blood pressure, then we definitely want to make sure we have a baseline to know if they are at all monitored or if they're stable enough to undergo, say, surgery or even just something simple as a filling.
Got it. Got it. So let's talk about some of the procedures. It was funny. I was talking to my daughter, and just I'm sure most of my friends know this. I had a Bell's palsy.
Oh. Okay.
Yeah, it was probably about maybe 15, 17 years ago.
Okay.
And as a result, I mean, thank God the facial paralysis did not last very long. But permanently, I have a crooked smile. And so I'll try to do like this, but it's crooked. So and then my teeth are okay, but I have natural gaps in them. And I said, I just they're small, they're really teeny. But I said to my daughter, I'm like, I want to get braces. She's like, no, you cannot get braces. You're too old for that. Like, you can't get braces. You cannot do that. I'm like, is there a rule about that? And she's like, it's just not cool, Mom, for an older person to get braces.
Oh, wow.
So this is my Gen Z daughter.
Okay.
Talking to her, late, early boomer, late millennial mom.
Right. Look, she's like, I'm a millennial, just so we're clear.
And so talk to me about that. Is there some standard rule? I mean, it's not a rule, but talk to me about older people getting braces. Do you advise that versus Invisalign? Like, what is that?
That is a very, very interesting subject because that's actually been a very hot topic lately. Most of us, as we start to age, we will tend to have shifting, okay? So whether it be crowding or spaces, if you've gone through some sort of orthodontic movement or treatment in the past and you were not retained, if you did not wear your retainer, those teeth are going to shift. That's just aging. No one is void from it. Okay. Now let's talk about the issue more so for me, and it's not about age. It's more so about who are candidates for it. Okay, who are the patients that would be a good candidate for traditional braces versus that of the what I like to call clear aligner therapy. And the reason I call it clear aligners is because there are so many different brands out there. Okay. There's the I choose not to say some of those names, but me personally, I use Invisalign. Okay. And right now that's their name. Right now, who knows if they might change it later, but I am using a form of plastic that will move teeth. Okay, I do not use metal bracket and wires. However, I have been trained to do so. But as of now, there's this new technology that's available for us to move teeth in which we, patients are able to floss Patients are able to eat the foods that they like to eat. It's a lot safer movements. They're not dramatic movements. Now, let's talk about patients that are candidates for that of traditional braces. And the reason I say candidates is because oftentimes I ask patients, what's your relationship like with flossing? And I'll have patients say, well, it's complicated, or, I don't floss often. And I'm like, well, if you were to place or have bracket and wires placed over your teeth, realistically, do you think you'd be flossing more often? Because it's a lot harder to floss in between each bracket and wire. Now, the reason that's a concern is because if you cannot get in between those teeth to floss, then you will end up with decay.
Wow.
Okay. Yeah. You can end up with bone and gum disease even. Is
that gingivitis?
Gingivitis, gum disease, and periodontitis, bone disease. Yes, ma'am. And that's one of those things, and it's not so much of age, but realistically, as we age, so does our teeth. Okay. And so if your teeth, in fact, have, say, fillings or any type of restorations in them, you are going to be more at risk for getting another cavity behind that bracket and wire. So again, if you're a patient that I had a patient today, it's actually so very common. And again, it's not about just an age thing. It's about whether or not that person is a candidate for it. And so, I just advise, and it's easy for someone to say, yeah, go get the braces, the bracket and the wires on. But realistically speaking, I had a patient today, and I'd say about 85% of her teeth had decay. Okay.
Wow, because
she had braces about 4 years ago, and she was in her mid-40s. And so she was very disturbed because she says, I don't like the stains on my teeth. That was one. And she said, and then all of a sudden I started to develop all these different cavities. Well, I had to dive a little deeper because we can't just say, oh, the brackets cause the cavities. That's not where we were. But there was a few more factors. So we found out that this patient also was experiencing acid reflux. And so acid reflux is a condition in which there is acid that's coming up from the stomach, and from the GI. And so it will, either if it, patients tend to vomit from it, or if it's just sitting, you're talking about a low pH that's going to sit on the teeth. And if anything is in low pH, if you think about it, anything acidic, it's going to burn a hole, okay? So that's how cavities form. And so realistically, if you have a bracket and wire on each tooth, and you have GERD, something like GERDs, or if you say, you experienced a lot of, vomiting at some point, pregnancy, okay? So I have a lot of patients that, they've experienced bearing children, and so they tend to vomit a lot. And so all of those things are dry mouth even. Oh, multiple medications, that's a whole nother subject, These are all things in which are not good factors to have if you're going to be getting traditional braces. If you have lots of existing restorations, if you're not an avid flosser now, So again, I don't advise against it just to say no, don't get them.
Yes.
I have patients in which I have had to say, if you don't think that you're going to be compliant with the clear aligners, then, we can, in fact, get you to, an orthodontist for traditional braces. But I have to, like I said, admit, that is something that does require a lot more oral hygiene.
The braces.
Absolutely.
So why would someone prefer the braces over the aligners? What's the preference?
That's a great question. So, I will say there's a few reasons, okay? There are some that will say, listen, I'm just not going to be compliant, because with the clear aligners, you are given a series of aligners. And so each set is going to move those teeth into the desired position. So each set, you wear one set for either a week or maybe two, depending on your prescription. And so from there, each set is going to either, expand if there's crowding, and if there's spaces, it's going to, contract, okay? So that's a patient saying, listen, I'm not going to be compliant, just give me braces, okay? That's one. Then you have the patients that they like the way the bracket and wires look on their teeth, okay?
Really?
Oh, absolutely.
It's a fashion statement?
It's a fashion statement.
Whoa, okay.
Yeah, so especially the younger kids.
Yeah.
So my pediatric patients, they're like, oh, Mom, like, I want them.
They want the colors
They want the colors.
Yeah.
And I get the teenagers want that, and that's
Right.
great. But then there's a lot of adults. I think part of it is it's this youthful look. You know, it gives them this youthful look. I'm not saying everybody, but it gives them this youthful look. And I mean, for whatever reason, don't get me wrong. I do have patients that'll say, listen, Dr. Monford, I'm just not going to be compliant. We have to have that conversation. Absolutely. I will take the time to get to know what my patients want, what their necessities and what their needs are. And we go from there. I educate them. Now, here's the other thing behind that. Another reason why a lot of folks like to get the traditional braces, because they think one is going to be faster. That's another thing. And it's not so much that it's going to be faster, because the reality of it is, yes, a bracket and wire is a lot stronger than plastic. However, it's about the bone remodeling that still has to catch up. So it's not, in essence, going to be faster than that of the clear aligners. And then there's all other factors, again, male versus female. So I see a ton of patients. I'm actually a platinum provider with Invisalign. So I see a ton of patients, and I'm doing my own in-house study. And what I found is that women patients, we in fact move a lot slower than men patients. Do you know why?
Why?
What holds our teeth? Bone. And as we age,
we lose bone density.
Well, not just that. Think about it. We hit a certain age, and then they say, hey, it's time for you to go have your bone density test, right? So not everyone has that same, composition of bone, whether it be strengthened teeth or strengthened bone. Some of us have to have bone supplements and things like that, or some sort of bone medicine to help with the density. And so when you think about the different compositions of bone, a lot of these patients, when we're talking about moving teeth, sometimes it's a struggle to move some of that in women patients versus that of male patients. So my male patients, I mean, they
go right through
it. Yes, and them teenagers. Guess what? They're going through puberty. They're going through growth spurts. So they are much easier with movement.
Wow.
Okay. So those are all different sorts of factors. Absolutely. But there's one other component that folks like to get braces. And I think patients have this idea of wanting to have a certain look at the end, and see whether you do traditional braces or clear aligner therapy, it's only going to move teeth. It does not change the shape of teeth. So a lot of patients don't understand that part of the treatment as well. So they'll say, well, I want braces, and they have in their mind that they want their teeth to look a certain way, when in fact the braces are only going to put the teeth into the position. And so at the end, you still have to retain those teeth. Right. So if you're not going to wear the retainers, and that's one of the things I was trying to explain to one of my patients. I have a few patients, they're getting on social media, and they're like, Invisalign or braces? Invisalign or braces? And I'm like, well, it's whatever you'd like. However, let me educate you, because I have a ton of patients in which that have gone to do the braces. I've had patients that say, oh, I'm going to go to the school and get the braces because it's cheaper. Well, I have a patient right now that said it was cheaper for her to go over to this school and get these braces. And would you know, I'm going to have to do about 3 root canals on her. Wow. So I'm going to be honest. I'm going to make more money off of her that way. I'm just being honest. I'm going to make more money off of her because she has to get 3 root canals in addition to, she had to go get braces. So that's my point. There's a different factor there when it comes to, saying, well, this is going to be cheaper. And it's like, no, actually not long term. And then not to mention, you want healthy teeth. You want healthy teeth. And again, it's just not for everyone. That's all I'm saying. It's not, I'm not against braces by far at all. As a matter of fact, my husband was not compliant, and I'm going to go ahead and put him right on out there. He was he was actually, when I first started offering Invisalign, he was one of my first patients. And he was not compliant. Oh my God, it was terrible. It was terrible. So anyway, guess what? He ended up having to be one of those patients that I had to refer for traditional. Absolutely. Wow. Absolutely. So some patients, they're just not, and that's okay too. And so for me, I just think that it's best, and it's most important for you to get to know the patient, understand what their needs are, and finding out if they are
what their goals are,
and finding out what true, in fact, what if they are candidates
if
at
they're
the end
candidates.
absolutely.
Got you. Wow, that is so interesting. You think you don't know all the behind that goes into making a decision about, and it's so good that you have a dentist that will consult and not just give you what you say you want, but really give you the option so you can make the best decision.
Absolutely.
Talk about veneers.
Ooh, I love this one. Ooh.
Talk about veneers.
So let's talk about that. So funny you say that, right? So initially I started out over in Arlington when I started practicing. When I got to the town center, I said, oh, I'm gonna be a cosmetic dentist. I'm doing Botox, so we can talk about that too. So when you start to talk about your lip line and when you smile, we can talk about if we have to, give a little Botox to calm that muscle down on the opposite side. And so Botox, lip filler, veneers. I'm like, oh yeah. Well, COVID hit, and everybody started wearing masks. I said, well, my goodness, where's everyone at?
Patients.
Where are the patients?
Right.
Well, they were coming. But guess what they were coming in with? Toothaches. Everybody was home. Things shifted. Okay. So everyone thought, around that time, I was preparing to be this cosmetic dentist, and I was preparing for what we call a shift in sort of my what I was going to be offering. But that's not what walked in the door. So what walked in the door was toothaches. But I digress there. When I say that, I had to adapt to where we were in society, where we were in, with everything going on. However, when it came to the veneers, and I mean, I do them, it's not my focus. However, let's talk about that. A lot of people want veneers, and I always like to make sure I explain and educate my patients.
Right.
Again, I can provide veneers. As a matter of fact, I love to drill and fill. I'll tell you real quick. I love drilling and filling.
So go back. Just explain exactly what a veneer is. I'm assuming that everybody knows.
Oh,
explain
my goodness.
It is.
That's a great question. So veneers are that of a prosthetic-looking crown or shape going over the front tooth or side teeth. Now, the word veneer just means that the entire tooth is not covered, only the front. So I have patients in which they have a combination of veneers and crowns. You'd never know whether or not they have a veneer crown unless you were to lay them back and look. So a lot of times I had a patient in the other day and she said, oh yeah, I have 6 veneers. And I'm like, no, you have 6 crowns. So veneer is just another extravagant name that society likes to use. Yeah, it's crown. So a crown is it's covering the full tooth. Okay. However, a veneer just does not cover the full tooth. It's basically about protecting or not having to remove so much enamel. But not everybody is a candidate for that based off of, say, if they have a deep bite, right? If their bite is completely covered, the bottom teeth are completely covered, I might not be able to put a veneer there, or even a crown. They may not be a candidate. So oftentimes I have to start talking to those patients about, well, let's open your bite up. Now we have to start talking about
a surgery.
Well, no, Invisalign. I can open them up with some clear liners. I can open them up and then place those. So ultimately, it becomes how can I help you protect your investment? Okay, because a lot of people are going out of the country because it's cheaper, okay? I get a ton of patients in here that'll say, I cracked this. This is my 3rd time, or this is my 3rd one. I've cracked this. I've gone to Miami. I've gone to Colombia. They've gone to Turkey. There's so many different places where they think it's cheaper. And in fact, it sounds like it's cheaper, but in essence, unfortunately, some of these places are not honest with those patients because they feel like, oh, you're going to go back to the States. I will never have to see you again. But this is the part where what they are forgetting. There's maintenance that's required. So when you're talking about a prosthetic added, porcelain to, each tooth, maybe at least 10. Most people go for at least 10 going across the top. And if they're going to do the bottom, another 10 on the bottom. Well, what does that mean? Prim and proper. Porcelain is like glass. Okay? It's pretty, but if it cracks, you got to get it replaced. So imagine having 20 veneers.
Wow.
And we're 80 or 90. How are we going to keep that maintenance up?
Wow.
So some folks think like, oh my God, veneers are this, this the end to all be all. This is it. No, it requires maintenance. It is almost like a fingernail that's attached to your nail. If there's any type, if you dig your hand in, say, hair gel, you ever put your finger in and you're trying to do your edges, and you get a little bit of gel right around the little neck. Well, that's a veneer. The idea of that is the neck of that veneer is near the gums. So if you're eating food and what's sitting around the neck of that, that veneer,
right,
decay can start if you're not properly brushing.
That's what I was going to say. How can you? So the veneer has the teeth almost bonded together. How can you floss? Can you floss?
Absolutely.
You still can floss.
Yes, you can still floss because a veneer is a single unit. So a veneer would be here, 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 here. So I can still floss in between each veneer. Now you may be thinking about a bridge. Sometimes if there's a patient that say they might be missing a tooth, we can bridge these teeth, and then we can talk about having to go under. We'd have to show them how to use a floss threader to floss underneath.
Gotcha.
But a veneer is a single unit crown, partial crown, if you will. So yeah, they can floss. The issue is depending on how it's sitting on the tooth. Again, if you I'm going back to the fingernail. If it's just sitting on the tooth and you happen to make a movement like that, it can pop right off.
Pop off.
Right. So if it's not enough retention, you're gonna be in trouble.
Wow.
Okay. You're talking about having to replace them every now and then.
And they're not cheap.
They're not cheap, and it doesn't look good. It looks like a piano mount. That's what I call it. If you start popping, multiple start popping off, it starts to look weird. If you're out of town, or if you're in town and you got them done, out of town, you gotta. I mean, it sounds cheaper, but is it really if you got to keep traveling out of town? And so, I think what some people don't realize is that, here in the States, every inflation is everywhere. And so the cost of materials, the cost of, I have equipment in the back that's, worth $60,000, $70,000, like this equipment, it requires maintenance, there's your staff, you have lab fees, you have all these different things, the materials in which it takes to make the temporaries, making sure that your hand pieces are properly working, burrs, all these different things that comes with a cost.
Got it.
And so veneers, our fees here in the States are going to be a little different than that of Colombia or whatnot. And so, the reality of it is, though, I always tell my patients, I offer my warranty, though. And I have a couple of cases that I'm following that are 10 plus years. Guess what? These were patients in which, before we got started, I could have just placed veneers over their teeth, but I started to let's talk about the function, because if your teeth are not in the proper position, you can continue to break and crack these veneers. So we got to talk about, well, wait a minute, let's make sure that, you're not going to be hitting or impeding on that veneer.
Right.
So we want to make sure we correct that bite, make sure that bite is nice and stable.
Okay.
Now I can place those veneers. And I have a couple of cases, beautiful cases, that, again, 10 plus years. They still look amazing. Still look amazing. They are still the patient has great oral hygiene. That patient comes in every 4 months for her cleaning. Because again, you're talking about maintenance.
Got it.
It's not, can't compare your, nothing wrong with a Toyota. I love Toyotas, but you can't compare like a Toyota to what is Maserati. It's almost like it's a luxury way of living now, right? Because you're talking about a veneer on each tooth. It requires a lot of maintenance. So a lot of people, it looks nice, it looks all Hollywood, but a lot of folks are not being honest. They're not telling the truth about some of it. It's going to cause lots of sensitivity. Some of them are, they'll say, well, listen, I can't eat this, I can't eat that. It's a lot of eating restrictions, but you look nice.
Right, it looks good.
But you look good.
Okay. So another cosmetic procedure is bonding. Okay, so in lieu of doing a aligner or braces, you can bond the teeth to take away spaces. Tell us about that procedure.
That is a great. I actually offer that too, and we call them chairside veneers.
Okay. Or
chairside bondings, depending on how much tooth structure I'm having to build, or how much space I'm having to cover. Now, so oftentimes we come across patients in which they've gone through, say, braces or some sort of orthodontic movement, and there's side teeth that we call peg laterals. That means that they're just misshapen. They're not as large as the surrounding teeth, so we have to do like a build-up to give them that ideal sort of shape.
Like you're creating the new tooth.
Absolutely, you're creating a new tooth. Now that is composite bonding, as you were mentioning. It's not porcelain, and I did not have to drill on their teeth. So in essence, this is something that is a lot more safer. However, oftentimes, and I've done a live about this in the past, because patients will often say, well, what's the best option? And it's not so much one or the other isn't the best. It's that when I do a bonding of a chairside veneer, I have a little more control over how I can make that tooth look very ideal to the adjacent teeth. So I can make it look as natural as possible versus trying to match a porcelain crown to a natural tooth. Sometimes that's a lot harder, but I can manipulate and again, that's when I become an artist. Like I love artists. I love working with my hands, and so I will mix colors and shades to identify or try to mock that of the adjacent teeth. Okay. So that is bonding. However, is it stronger than that of porcelain? Yes and no. And I have to say it like that because depending on the type of forces that are coming down, if you're chewing or if you happen to bite into something, can either of them crack? Absolutely. Which one might crack quicker? We won't know. I'm going to be honest. I've had patients in which they have porcelain and the porcelain will crack almost instantly, but it's actually stronger. But it will almost crack instantly just because of the way they bit down. Now, bonding, same thing. Can it trip? Absolutely. And so, in essence, it is one of those things in which it's a case-by-case basis. Okay. And I have a couple of cases in which I will offer my recommendation to patients as far as, if it's only a couple of teeth, we can talk about bonding. However, if you're talking about wanting to do 10, I mean, it's nice, but it's more controllable if you do what we call the porcelain veneers, because when you're doing what we call direct, so me doing a chairside veneer or bonding, that's direct application. The issue with that is sometimes if you're trying to do multiple, you can incorporate lots of environmental factors like saliva, anything that's coming out of the gums, so that can cause, an interruption of the bonding. So in essence, you're talking about, well, wait a minute. If it's only 2, not bad. But if you're talking about 10, you're talking about maybe having to replace these a lot more often. But I can say I have done those in the past. I've done a few cases, and I mean they're beautiful cases. They're actually still in place right now. But just like paint on a wall, if your person loves to cook, and you might have a little bacon on the weekend or some fried chicken or whatever, that wall is going to absorb all of those, environmental factors. So what's the difference with that, or what's the same? So when I bring that up to say certain foods that you might take in, over time, the composite, that bonding is going to alter that of the shade over time. And I mean, it's not terrible, but again, you have less of that happening with that of your porcelain.
Got it. Wow. Interesting.
See, listen, I can go all day. I love this stuff.
I'm telling you.
Listen, I love this stuff. I get really excited. Yeah. Sorry.
No, I love it. So listen, we've talked a lot about teeth that we want to make beautiful. Let's just talk about our teeth. We're not getting porcelain. We're not getting bonding. We're not getting veneers. We just want to take care of our teeth.
Absolutely.
So obviously you have to brush, but some people believe that you only have to brush. Like you don't have to floss. Like you have to floss.
Absolutely.
Right. So talk about the importance of that quickly.
Oh yes, absolutely. So the more recent thing is, oh my God, I have patients that say, oh, I have a water flosser, so I don't have to floss. And I'm like, no. It doesn't replace traditional flossing. That water flosser is not going to remove the particles that's in between the teeth. And so ideally, if you've ever eaten, say, I don't know, every now and then, if you're eating, what was I eating the other day? I think it was some crab legs. Something just slithered right in between.
Yeah.
And I mean,
and you can feel it.
Yeah, I'm like, if I could just get a piece of floss right now. And see, me, I'm going to be honest. I'm a lazy flosser, all right? I am a lazy flosser. What does that mean? I'll floss, but I like to use those little plackers.
Yes.
Okay. However, I'm an avid flosser. I keep them in my my glove compartment right under. Well, not glove. What's that little armrest?
The armrest.
Yeah, I keep them in there. They're in my office, in my drawer. They're in
Mm-hmm.
my bathroom at home. They're in my kitchen drawer. The kids even got them in their bathroom. I'm an avid flosser. But I'm a lazy flosser. And I say lazy because I do not use the traditional way of flossing. So I say that just because I use those plackers, but you have to know how to use them. So you can't just go in and out. You have to go in, hug that tooth, and out, hug that tooth, right? So there's certain techniques that you must use. And so the reality of it is I like sweets and candy as well. Oh my God, I'm not even going to tell you what's in my nightstand next to my bed. Like, I love sweets. It's so bad. But I also know I have to rinse with some either water or mouth rinse or brush right after so that I don't leave that sugar on my teeth.
Got it.
That then talks about the low pH. So when we start talking about, say, orange juice, or even apple juice, if you test the pH of that.
It's very acidic.
Very acidic. Not as bad as your orange juice or your lemon. Most folks that like, water with lemon, right? That's acidic. Again, that is coating the teeth, okay? Foods that we take in. It's like, oh yeah, I love fruit. Acidic, right? So these are things. I had a patient, I've been seeing him for years, and all of a sudden I started seeing these cavities going across. And I said, well, Mr. So-and-so, like what? It's almost like a change. Like, any changes in your diet? And he was like, no. So I'm like, something's up. Like, I have not seen this, And all of a sudden he had to come in. I had to remove 7 crowns on him, all because of this like newfound decay. And he said, when he finally came in for the treatment, he said, Dr. Monford, you asked me what did I change in my diet. He says, my wife started making these lemon sorbet, and I would have 3 cups of these before bed at night.
Okay.
3 before going to bed.
Before going to bed.
And then lemon sorbet. So you're talking about acidic and something sweet.
Yes.
And he had 3. So that means he was just coating his teeth. And then right before bed is the worst time. Why? Because now all
that is going to stay
right there. And that's what happened. Oh my God. So the reality of it is it wrong? Not really. But that means if he's going to have it, he has to go brush it off.
Right.
But the reality of it is a lot of people end up with a lot of issues because of education or the lack thereof. Okay. They don't know. And so that's the thing. When you say, well, if we're not going to get these things, how do we just maintain and just take care of what we have? That's where I talk about lifetime care. My oldest patient, she's 97 now.
Wow.
97. She's 97. Now, granted, I just started seeing her in the last 4 or 5 years. However, she comes, faithfully every 6 months. She has great caregivers. Her family are amazing. And then I have my youngest patient is about 9 months old. Okay. Now, most people might say, well, why do you have a 9-month-old in your office? Well, it's not so much that I want to see them for decay. It's because I want to educate. That's right, prevention, but I want to educate mom.
Yes.
Most of us didn't know what to do. I remember seeing my family put their babies to bed with the bottle in their mouth. And then later they end up with what's called bottle mouth decay. So that time is not so much for, I want to, take an x-ray on the baby. It's about, how do I make sure that I'm educating mom and dad about how to properly, care for their baby's teeth, and also just getting them used to the sounds and the noises and things like that. So, but yeah, youngest patient 9 months, oldest patient 97 years old.
Amazing.
And the reason I say that is because there's a large range there, right? Yeah. So there's a lot of different factors. I got, the toddlers, where they start falling. They have all these falls, and then you're talking about, oh my God, this tooth is discolored. They're going through this, what they call primary dentition, the baby teeth, and then they start shedding teeth every 6 months. They come in with a new different smile because they're growing, right? Then they hit almost what you say, like right before they hit the double digits. They're about to go through the snaggle tooth. They're finishing up the snaggle tooth, and now they're about to head into permanent dentition. So why is this important? Well, that's the last set you get. You don't get another set unless you're going to need dentures, and that's what I want to prevent. I want to prevent
dentures.
I want to prevent that. But if not, we can talk about that, because then we can talk about implants too.
Right.
See, that's a whole nother story. See, you see where I'm going with that?
It's such a
listen,
wide,
it's a wide variety.
Listen,
I can keep going now. I can keep going, but I'm not. Yeah,
wow.
you know,
Amazing,
absolutely,
amazing. There's so much, you guys, that we take for granted when it comes down to our dental health. We just think, get up, brush before we go to bed, brush. But there's so much, as you heard from Dr. Monford, Dr. Chrissie, talking about how and why it is important to understand dental health. So very important.
absolutely.
So if you were given the top 5 things, okay, let's talk prevention.
Yes.
Prevention, for decay, prevention for cavities, prevention for the need for dentures or any other type of cosmetic. We realize that cosmetic is for beautification. It may not, you may not have some problem that's causing you to want cosmetic dentistry.
Absolutely.
But if you were given the top 5 tips, for people who want to just take care of their mouth, what would those tips be?
Ooh, okay. Top 5. 1, definitely regular routine dental visits. That's 1.
What's regular? Is this every 6 months?
So if you do not have gum or bone disease, so if you do not have periodontitis, then every 6 months. Okay. However, patients that have that disease, they are seen a lot more frequent. Okay. Because they have pocketing that they can't quite clean. Okay. So we see those patients every 3 to 4 months.
Got it.
So routine dental visits.
Okay.
Watching again. We are what we eat. So, watching what you are putting into your mouth. What are you coating your teeth with? So, for instance, if you like coffee, I like coffee, but I like my coffee real sweet. Okay, I'm more of a.
You like a little sugar with your coffee.
There you go. Yeah, I love me a lot of sugar and creamer.
Right.
So, but it's one of those things. It's not. It's also about frequency. So, if you are going to have that cup of coffee, you want to make sure that you're not sipping on it all day. You don't want to keep coating your teeth. So, you want to have that cup of coffee and be done. That's if it has sugars in it. Okay. So again, that is, routine. Watching what you're eating. And then the frequency of that. So making sure that, if you're going to have, say, a slice of cake or whatnot, it's not something that you want to, continue to eat all day, routine oral health at home, or oral care at home, brushing and flossing. That is hands down.
At least twice a day.
At
right?
least twice a day.
At least twice.
That'll keep the dentist away. I'll tell you
twice a day keeps the dentist away.
That's right. It'll keep the dentist away. I mean, I love what I do, and if not, hey, I love drilling and filling. Come see me.
Drilling and filling.
Drilling and filling. I love it. Absolutely.
Okay.
So yes,
oral care at home.
Oral care at home. And radiographs. That's another big
radiographs.
Thing. Radiographs. And I say that because more recently, every now and then I get patients that have been coming in. So radiographs and fluoride. So there are a few factors, and I know there's a lot of things swarming around about fluoride, okay? But radiographs, I've had patients that says, oh, I don't want to have this radiation. Well, back in the day, radiation was a lot more severe, if you will.
The radiation
X-rays?
X-rays, yes.
Yep, radiographs, X-rays. So see, I'm even trying to change the verbiage there. Because when you hear X-rays, most people, it's like, oh God, they for some reason, I don't know what it is.
They freak out.
It's like, oh my God, it's radiation. So our radiographs, we have more of what we call a digital form of that now. So it's not as strong as it used to be. So what we use now is a lot less than you just standing out in the sun. Okay. So a lot of patients are afraid of those radiographs. So we get some patients that have, decided not to even come if I can't take a radiograph. Well, they didn't teach me to have X-rated vision. So I got to have an X-ray to diagnose. And, you're not the same way that you were a year ago.
Correct.
Okay. So we use our teeth every day.
Yeah.
There's, all sorts of things, whether it be I eat nuts or whatever that case might be. And so there's changes. So we got to have updated X-rays. So don't be so, against those. Now, fluoride, that's a whole nother story. I had a patient today. She says to me, oh, fluoride is so toxic. And I said, well, anything in excess is toxic. And she said, no, you just don't understand. No, I do. So I said, let's talk about this, because right now I just found 5 cavities, right? And you're saying no to fluoride when I already know that the lack of fluoride you are more likely going to have, these cavities.
Mm-hmm.
Now, these cavities, if untreated, they can turn into abscesses. These abscesses, if untreated, can become septic. This is a fatal thing. So this can act. So when you start to talk about risk versus reward,
yeah.
We're not saying go and drink the fluoride,
Right.
but we're saying it is a topical form of use that, in this particular form, it is not as harmful if you are just using it topically.
Got it.
Now, again, anything in excess is a problem,
Yeah.
or it can be, a toxicity.
Mm-hmm.
So, in essence, fluoride, making sure, yes, you do be okay with having those x-rays taken, oral hygiene, oral care at home, brushing and flossing twice a day, routine visits, absolutely.
Wow. Okay.
Absolutely.
Top five. Did you hear that? Top five. See if I remember. You have to make sure you have your routine visits. You have to have your oral care at home, which is brushing and flossing at least twice a day.
Absolutely.
You have to watch what you're eating.
That's right.
Make sure you are not coating your teeth with sugar all the time.
Absolutely.
And if you are eating an excess amount of sugar, you need to make sure you're brushing and flossing even more. Absolutely. Is that right, Dr. Chrissie?
Absolutely.
Your x-rays. You have to get x-rays because your mouth, just like we change, your mouth shifts and changes.
Absolutely.
And then finally, the fluoride.
You have to have fluoride.
Don't be afraid of it.
Don't be afraid. I mean, I know there's a lot of, so I get a few folks, there's a whole nother, subject of, things that are out there, as far as holistic and, all those different things. And I'm not against it at all.
Yeah.
However, holistic is a way of living too. So you can't be in disease.
Right.
To say, oh, now I want to do holistic if the decay is already there. If there's a hole that's already in that tooth, holistic is not going to work to get rid of that hole. You see what I'm saying? At this point, we got to talk about, wait a minute, this is correction. Absolutely.
Got it.
So holistic, again, is a way of life. And it's like, you have to start early. Let's talk about that now. So if we're going to go holistic, we have to do this earlier. When it comes to decay, that is.
Got it.
Okay.
Got it.
But then when you want to talk about, cosmetic to enhance the smile, we can talk about that too.
Yeah, cosmetic is good.
Cosmetic is great because, when you look good, you feel good.
Yeah, this is
know,
true.
Just saying. When you look good, you feel good.
This is true. This is true.
I
mean, and when I say that, I've always grown up with this belief that, man, the mouth, you look at that, you're looking at a person, anything, how they smile.
Absolutely.
That makes it such.
This is your trademark.
It impacts your confidence, all of that. So smiling is very important.
Indeed.
And even with the crooked smile. We
That's
have to talk about that little Botox shot.
Absolutely. Let's talk about it.
Talk about that.
Because see, Botox, that's a whole nother seat. That's a whole nother conversation. Yeah.
We can do this again.
We can do, absolutely. We can talk about cosmetics.
We can
go straight to, I can have some fun with that.
You can see that she loves
I love what I do. I'm crazy. I'm such a nerd. I'm like, oh my God. Yes, let's talk about it.
We're talking about teeth.
Girl, that is up my alley.
I absolutely love it. Listen, Dr. Chrissie, thank you so much.
Absolutely.
This was so enlightening and so educational. And the thing about the Trust and Know the Jackie Boy podcast is we're bringing you people who have something to say, and you had a lot to say.
Oh, yeah.
We want to give you information that's going to help you to be the better version of yourself.
Absolutely.
Information, education, but mostly inspiration. So this doctor right here definitely inspired us. She gave us a lot of information, a lot of great tips. Remember those top 5. That's very, very important. Don't be afraid of the dentist. Don't be afraid. And you are accepting new patients.
Absolutely.
Okay, so she's located in the town center. Come check her out. She will definitely take care of you.
Well, and your families too.
And
we are a family, that family dentist. Absolutely. We'd love to take care of you and the family.
Very good. So listen, guys, thank you so much for tuning in this week. Oh my goodness. Thank you, Dr. Chrissie. This has been wonderful.
Thank you.
Remember, we're on every second and fourth Tuesday of every month. We're going to bring you people who have something to say because we want to inspire you to be the best version of yourself. So tune in every second and fourth Tuesday. Trust, Trust, then know, Know. Trust and Know the Jackie Boy podcast, and you will be informed and inspired and educated. So until next time, bye.
Thank you for listening and watching this episode of Trust, Then Know, the Jackie Boy podcast. We hope this episode has left you informed, intrigued, and inspired to become your best self. Remember to tune in every second and fourth Tuesday of the month and trust, then know.